And if you think about it, your lungs are like balloons. You've got lungs that expand, that inflate when you take a breath in. Sometimes, after COVID, you may be left with pneumonia, which is a form of infection, or fibrosis, which is a form of scarring, and these can give you that sense of restriction. Hi, my name is Dr. Helmy. I'm a lung specialist, and I'll be answering questions today about long COVID. How long does the recovery process take? Is it possible to suffer from long COVID for the rest of your life? The answer is nobody quite knows because everyone is different. What we do know is that for the vast majority of patients, symptoms only last between 3 to 6 months, and with the right treatment, with the right sort of rehab, things are much better after 6 months. There are a small number of people who may have symptoms beyond 1 year, and what we do not know yet if this will last forever. Research is ongoing, and hopefully with the right approach, things will definitely get better. I can hardly breathe deeply like I used to before COVID. It feels like my lungs are restricted every time I try to breathe. Should I do breathing exercises to reduce the effect? Breathing issues, breathlessness are a very common symptom when it comes to COVID. Unfortunately, the lungs can be affected at times. And if you think about it, your lungs are like balloons. You've got lungs that expand, that inflate when you take a breath in. Sometimes, after COVID, you may be left with pneumonia, which is a form of infection, or fibrosis, which is a form of scarring, and these can give you that sense of restriction. It's important to rule these out by seeing a doctor. Having said that, exercises are a really good idea. You could do things like yoga, brisk walking, but there aren't any specific exercises that you would do for your lungs unless you go for things like physiotherapy. Is it possible to prevent long COVID? Long COVID is a syndrome where there are a number of symptoms that persist 3 months after one has had COVID. Now, if you're somebody who has had COVID, the best way to reduce the risk of having long COVID is to ensure that any symptoms are addressed early. So see your doctor or get to the appropriate rehab center without any delay. If you are an individual who have not had COVID at any point, then your best protection and the best way to prevent is to get yourself vaccinated and adequately boosted. There is plenty of evidence to show that if you're adequately boosted and protected, your risk of developing or having long COVID will be far reduced. I'll be answering more questions like these in the upcoming BFM Health and Living Life by AIA Vitality, where we're exploring life in the next normal. Find out more about the event in the captions below.